Thank you very much, Ariel, and thank you all for all that you are doing. I was really very excited. At my age, I almost said thrilled, but I'll stick with excited, at how much energy there was in the room yesterday. It was wonderful, just filled with energy. And now it falls on us, beginning today, to turn that energy into action. Action. To work in ever closer coordination, becoming more effective and efficient at a time when resources are more precious and perhaps more precarious than ever. Action to learn from each other and to support one another as we move forward to end preventable child deaths. Action to renew our promise to the world's children by doing everything we can to save their lives. That is what a promise renewed is designed both to spur and to support. As we heard yesterday, and we will hear more about today, we have an opportunity, and more than that, the capacity to advance the right of every child in every country to survive and to thrive. I'm pleased to tell you that as of this morning, dozens of civil society and faith-based organizations have signed the pledge, and some 40 governments have already joined a promise renewed as well, adding their pledges to those of Ethiopia and India and the United States. And I hope these pledges will inspire many more to follow, and I am sure they will. For it'll take both national efforts at all levels in each nation and global effort to achieve our wonderful goal. So we have much to discuss today and much to do in the tomorrows that follow. And who better to set the stage for us than a man of action and passion and persistent leadership, somebody I'm about to embarrass, as I warned him, with well-deserved praise, a gifted researcher whose work to defeat malaria has brought us closer to the day when that scourge no longer claims so many lives, and especially young lives. A dedicated public health advocate who recognized early on how critical community-based care is in building a strong national health system. An innovator who has advanced our guiding principle, national ownership of development plans, and in doing so is helping to change the way that governments and donors work together to achieve greater results. I'm speaking, of course, about the Ethiopian Minister of Health, Dr. Tedros. I learned that that's what I mean. You say the name, applause. And I found that true all around the world. The name Tedros, I learned, is perhaps derived from and very similar to the Greek word Theodoros, which means God's gift. Now, how's that for embarrassing you? And certainly for the children and women and everybody, all the families of Ethiopia, and from all of the children around the world who have benefited from his leadership, that is definitely so. So it gives me great pleasure to introduce the first speaker of this, the second day of a call to action for child survival. Please join me again in welcoming His Excellency, Minister Tedros.
I think that's too much. Anyway, thank you for the embarrassment. I believe that we had a very good day yesterday. It was really exciting for me personally, and I enjoyed every bit of it. And I'm really honored again today to have this opportunity to open the second day meeting. I would also like to use this opportunity to thank Anthony Lake. I call him Tony, so of course protocols observed. a very good friend of Ethiopia. We have known him for maybe decades now. Very good support. And thank you so much for your leadership, especially on this session together with Raj. And I'm really happy to see you in action and leading us. And to you and to Raj, my respect and appreciation for this successful meeting. Then when I come to the issue I was asked to speak about, this is like linking commitment to action. To be honest, I would say I wouldn't really dare to say to you, let's take this action, because many in this room have great experience, and many of the things, we already know. And I wouldn't dare to do that. But in the corridor, yesterday and today, we were discussing informally with some colleagues, maybe asking me questions, and asking them questions and sharing some thoughts, some ideas. And I thought maybe discussing these issues candidly here may help into getting into action, because there are still some questions lingering that I have already heard. And it would help if I share with you some of the issues many people have been raising even before this meeting started, and also yesterday and earlier this morning also. Some issues I think that we need to discuss. So I prefer to focus on these issues. I have already listed them. Again, there are things that, it's only to just tell you my perspective of what I think, these issues are from my point of view. When I start, I think one of the issues being raised is about the vision. And two things are being raised on this. Is, 20, by 35 achievable? 20 per 1,000 live birds, achieving that globally by 2035 really practical? And the second question is, this long vision may detract us from our immediate goal of the MDG goals, the 2015. And from my side, this is my opinion, what I believe is the 20 by 2035, I even believe that it's not ambitious enough, maybe to just start from that. If there is a will, there is nothing impossible in this world, and we have seen it. I will tell you one good example in our world, maybe one country, South Korea. 40 years ago, their per capita income was $79 US, maybe equivalent to many of the African countries at that time, and many of them even now in that category. And in 40 years, it rose to over 19,000 US per capita. Imagine, this is even 40 years, we're saying in, under 5 mortality, 20 by 35. But 40 years, even 20 years is enough for a country to develop significantly, to transform itself. So if a country can transform itself in a quarter of a century, because South Korea has been already on the world's map since 20 years ago now, why can't we really dream high to achieve it? I don't think it's difficult. If there is a will, there is a way. And there are many countries like Taiwan and now China on the move, India on the move. You bring it, not only child health, but even overall countries' development can really change or transform if there is a strong political will and if communities can be mobilized around that national goal. And South Korea's secret, according to them, they say that it's their community mobilization, the Semaul Undong, they call it, which really mobilized communities village by village and succeeded in transforming their country. And can't we dream that much? I think it's possible. If there is a political will, and if communities can own their agenda, I think change is imminent and possible. So my answer to that question is, it's possible. But there are two factors we have to check. Is there a will, and are we willing to talk our walk? Are we willing to really combat and fight and make that happen? So I think we shouldn't have doubt as far as I am concerned. 20 by 35 is possible if there is global commitment plus local commitment. Not just only global, but the local commitment is even important, considering Ethiopia and other countries who should commit to really work hard. Then the second is, maybe I have already answered that question. It wouldn't distract us from the immediate goal. It's really good to have a kind of overlap between what you'd like to do in 3 years and also 25 years from now, by 2035, 23 years from now. It actually helps. When during succession, for instance, there is an overlap of leaders for some months, one exiting and the other one coming. So even in dreaming, it's good to think about the immediate one, maybe the 3 years from now, and think beyond and use that transition as a pad to even aim higher. So I don't think any conflict in there also. So these are the two issues I have heard in the corridor. Then it's country ownership. Country ownership, many of us take it as really something impossible, but it's possible. But we have to be persistent. We have to really sure about what we are asking for. And it starts from having a clear goal. We were discussing among colleagues, and that was what we have agreed at the end of the day. If we have the ends, and if we know the means, if we have the goal, and if we know how to achieve or to reach there, then it will be easier to negotiate with anyone to own our business, because we know what we want to do. So it starts from knowing what you want. You know, asking for ownership doesn't help. It's showing that you want to achieve something and you know how to do it, and you sell that. So that's what we have agreed. And it's possible. Of course, it needs a lot of commitment on both sides. I can give you some examples. And as what Tony said, wherever I go, I always say, you know, country ownership, national country ownership, and so on, because that's what I really believe. If there is country ownership, if there is ownership, if I own something, it's easier for me to commit to the something that I own. And if I commit, I know I can achieve result. But if somebody is telling me what to do and I don't own it, I don't think I would go even an inch. So that's the whole issue. So if I want to own, but if I want to own, it's again, I'm saying it's up to me, because I have to know what I want, the ends, and I have to know how to achieve it, the means. Otherwise, I don't think we can ask for ownership in theory. It's really engaging your partners, engaging those you're asking ownership from. But you don't get it from them, you get it inside yourself. The examples I want to give you is good examples, Global Fund and PEPFAR. Global Fund and PEPFAR, whatever they give is vertically raised. But from the start, we negotiated. This is what we want to achieve. We believe in health systems building. Help us to build our system while saving lives. So we want to use your money, not just vertically, but as what Julio Frank, my friend, was saying, horizontally and diagonally. If we can save lives now while building the system, then we're preparing the system to fight even for the future. Unless we do that, whatever we achieve now, the gains we make now, we could lose them easily. So let's think about saving lives now, but also building the system, preparing for the future. Then you can really have an added value, the value for money, of the money that you get. And I think Global Fund and PEPFAR were convinced, and our health system 6 years ago and now are entirely different. Be it the information system, be it the healthcare financing, new system now, human resources, pharmaceutical finance and supply system, the service delivery, building the primary health care, the system is now in a better shape and significantly different from what it used to be. So if you negotiate based on what you want, I don't think there is any problem. So that was what we have been discussing with some colleagues, and we believe that, you know, the country ownership issue comes from inside, having whatever you want to achieve and knowing how to achieve that, and the good examples are what I told you. But not only that, we have also asked many of our partners to give us basket funding. Now around 6 bilaterals have already joined that basket funding. And we get more than $150 million US per year through that basket funding. That makes our life easier. We prepare only one plan for these partners, including all the UN, by the way, 10 partners, one budget system, and one report. And the transactions are really minimized. And we focus on our programs because we don't get like confusing signals from all directions, observing that guideline for one plan, that guideline for that report, and so on. And this happened because of belief in ownership, saying this is what we want, and give us this. We started the negotiation in 2005, and by 2009, I think the partners, I have said, the 10 of them have agreed to join, and now we have started that. So this is another very good example of getting what we wanted. But it's not simple. It took 4 years or more. But still, it's part of building the system, so it's worth it, even the time it took to build that. But we hope that MDG pool fund or basket funding is helping us to even boost ownership, because not only we have the goals now, we own them, and not only we have identified the means, but since money is not enough, like there is scarcity, we also resource our plan based on our priorities, the high impact intervention that we were talking about yesterday. So this was the issue, and the issue which is being discussed under country ownership, but together with that, I think there were also some doubts to be, to candidly raise this issue. When this meeting was invited, this call to action, some people were complaining that, okay, countries are not involved, and this thing is like a spoon feeding and telling countries what to do. I don't think that's the case, because I have been in the process from the start. This is like to create the forum, and for any country to join the pledge and do whatever it thinks is right for that country. So it's up to each of us to really see what's being offered here and do it the best way we want. Because there are some doubts, even before this meeting and during this meeting, about the way it's being handled. So this is another candid issue I would like to raise with you, but I would like to also witness as part of the co-convener that this is like creating an opportunity for the countries to use this opportunity and use it the best way they can, set their own goals, whatever goal they want, and also do whatever is related to this based on something that suits them. If there is something contrary to this, I would be first to join you to say, no, this is wrong, and it wouldn't help. Because as I said, if there is no ownership, there is no commitment. If there is no commitment, there is no really result. Then when I say country ownership, that takes me to the third issue in that country ownership is, when you say I want to have my own goals, it doesn't mean that you don't listen to others. I can give you Ethiopia as an example. We have learned best practices from many countries, from our neighbors, immediate neighbors, from many countries in our continent, from Asia, from Latin America, from US, from Europe, almost everywhere. We have new information system, new pharmaceutical finance supply system, we have new healthcare finance system. We were even sending out people to countries to learn. Because why do we reinvent the wheel when countries have already passed through the same problem as what we are passing now? So learning from others, I think, is the best way. And copying, I don't think is a problem, unless you're a student and try to, during an exam, copy, and you get caught, it's done. But in this instance, copying is even the right thing to do. Why do we reinvent the wheel and waste a lot of resources? So many of my colleagues have been to many countries. We copy from your websites. We copy from, face to face. Let's learn from each other. So ownership means, it doesn't mean like you don't learn, you don't listen to anybody. You listen to what makes sense to you. You really are open-minded and try to learn. But at the end of the day, you say, this is mine. And you commit to that. So that was also one of the issues that was raised, especially with regard to ownership. But I would like to assure you, since I was here from the very beginning, that I haven't seen anything that really undermines ownership. Then the other important element that is being discussed is about why is child survival being discussed in isolation? Why not we talk about continuum of care? I think some people are trying to knock down that continuum of care or woman and child. That's the issue just candidly being raised in writing or even, talks in the corridor. But I took from the start this child survival call to action as part of the continuum of care. And you cannot see it in isolation. I don't think that can happen. Naturally, even you cannot see it in isolation. Because just let's take, especially during delivery and a month after delivery. In Ethiopia, for instance, more than 40% of the under 5 mortality is because of neonatal deaths. And the first months of the child is very crucial. And that during delivery and the first months of the mother after delivery is also key for the mother. So during that crucial time, especially, you have to treat them as one. They're just a pair. Even post, since the child depends on the mother, you will be forced to see both as one. And even go back, and family planning also has a great impact on child survival. So that cannot be isolated, and reproductive health in general. If anyone is saying this child survival is being seen in isolation, I don't think anybody had said that. But it's good to create momentum to discuss about child survival and have the forum. The center will be that, but we can discuss about the other issues together. And that can build the momentum, help us focus on one issue while seeing the whole spectrum as well. Otherwise, not only continuum of care, I prefer to see within the bigger health system and even with the bigger countries' development strategy, the economic development, the political development, and so on. That's how I want to see Ethiopia as a system. Then health as part of it, and even child survival as part of it. So we can see the whole system, and we can see the parts. The thing is, how can we see both, so we know the big system, and also we see the parts in it, and see how it fits with each other. But talking about one particular spare part or part is not a problem as long as that spare part fits within the big system, and we know how to make sense of the connections between the parts. So I haven't also seen any problem in that light. Otherwise, the whole continuum of care is really important, and we have to really see it within that light. And even if we want to separate it, we cannot separate it because it's naturally one. It's naturally one. So I came with that spirit, and I don't think there should be doubt again on this. But if there are issues, I think we have to discuss. Jack Welch said, candor is, the best medicine for any institution. So for our solidarity, I think candor is also important, and we have to discuss while here the whole day, and even we can communicate through other means. But it's really good to clear many of these doubts in order to go to action. I think no team can really go to a field to play with a full force without having a clear understanding of what it wants to do and really clearing any doubts or problems that they have between them. So we can discuss about these issues today and also in the future. In the continuum of care, maybe one thing I would like to say is the family planning is key. And in Addis, my friend Mohammed Pati, Nigerian minister, was presenting about the Ethiopia's demographic transition. And because of the increase in contraceptive prevalence and also decline in fertility rate, we see some transition to the, some demographic transition. And hopefully, if we continue, may be able to get the demographic dividend. But when we do it in Ethiopia, we don't have population sizing, by the way. He was the first one who showed me how the curve is really coming well. The Asian countries like Taiwan, Korea had the same kind of curve 40 years ago. So I was really excited to see that, although Mohammed had prepared the presentation, not me. And the issue I wanted to especially raise on that is, this is happening because of aggressive contraceptive, advocacy. But as you know, we don't have population sizing policy, and our policy is, families can decide how many kids they want and when they want. We only try to help them understand. Then it's up to them. They choose, they take it. If they don't, they can leave it. And because of that, there is trust now. And the communities are listening, the health extension workers, really more, which are deployed at grassroots level. But the current focus on contraceptives is important because we have to do that. But the future is, and the best contraceptive is girls' education. And we're heavily investing on that, as I said yesterday, and the strategic shift would actually come from educating girls. And I think when you talk about continuum of care, then all this comes into the equation, even the strategic thinking of girls' education that many of the speakers have been saying. Then I have already mentioned it, but the connection of not only the continuum of care, but the strong health systems is very important. But one thing I would like to raise on this issue is, especially when linked to the country ownership, the country's commitment, especially the developing countries, is really key. And in the health systems or the systems development, I think focusing on healthcare financing is important. And many countries are already building insurance systems. Because, as you know, we're in financial crisis, and some of the global health financing is really on the decline, especially the last 2-3 years. And unless we prepare right now to build our system and introduce ways of sustaining it, it wouldn't really happen. So, of course, during these forums, we expect an increase of finance, because this is also one of the talks in the corridor or something that we're discussing. Is there anything, any commitment that's coming in terms of finance? I think it would be good if there is some pledges or financial commitments. But it's also, we said, good to think about what countries can do to raise their domestic resources. Could be short-term or long-term. So when we think about additional financing from partners, it's always good to think really side by side about how we can sustain what we're gaining, and in the process, really, from time to time, minimize our dependence or the health system's dependence on foreign aid. Because many countries in Africa, including Ethiopia, the health system is very donor dependent. And we don't want that to happen forever. We want that to change. And I'm really encouraged in Ethiopia because we're saying we will join middle income countries by 2025. And by then, we hope we will really cut the dependency by a great proportion, although we may not be completely free from it. So we have already started the road, and that's the road, traveling, and we're introducing health insurance, both social health insurance and community-based health insurance system. Then that takes me to accountability, which is being discussed also. Accountability is really sensitive. How can we ensure accountability? Accountability, I don't think, can be ensured using tools like scorecards. Accountability has political dimension. There should be political commitment to account. I'll tell you one story when I was chairing Global Fund. Money from Global Fund was embezzled in 4 countries. That was very sad, very disappointing, and criminal. Of course, that problem was actually discovered by Global Fund itself. And the issue was discussed in our board openly. After that, Global Fund started taking action. But some countries have either stopped financing Global Fund or decreased their support or whatever, without even discussing what they wanted to, the action they want to take in the board, unilaterally. So meaning there is no accountability. It was zero. Many countries just decided. So the fear is the issues being discussed in the corridor. Okay, we're talking about accountability, but can we achieve real accountability? No. When countries like, what we have experienced during the Global Fund, when Global Fund became the victim of its own success, I say it from my heart, Global Fund was then a victim of its own success. It was transparent, identified the problems, took action, but it was punished for that. That some countries immediately stopped financing. And not only the stopping of the financing, but even the political, loss for Global Fund was great, huge, something that's very difficult still to mend it. Is this accountability? No way. When countries, although are members of the board and they decide unilaterally, no. They shouldn't. They shouldn't have done that. By the way, we voiced our concerns then. And I think that accountability issue has political dimension. So the capitals decided now. So if the capitals of the countries who are helping do not see this as solidarity and really using platforms to decide together, I don't think there will be accountability. And one knocks down accountability, the other party will also say no accountability. Imagine how one action triggers the other one. I remember some countries were saying, we will never take money from Global Fund. Of course, it's recovering now. I would like to congratulate Simon Bland and others who are really working hard to change the tide. Of course, I'm not saying there was no problem in Global Fund. There was systemic problem. But if it's transparent, you can still believe that you can mend it and move on. Because there is no system which is without a problem. But the issue is, if it's transparent, I would be happy to work business with a transparent organization, and that was what Global Fund was and should be. And it should be even in the future. By saying it became a victim of its transparency, I'm not saying it should change transparency. It should stick to transparency. But we should stick to the accountability also in that transparency and discuss the issues. So this is really key to the accountability also we discussed here. If we say accountability, is it really true? If we say accountability, is it really political? If it's technical tools, no, it doesn't even work. Scorecard can work if there is political will. So that's why I'm stressing on this accountability issue through the tools we want to use, of course, but the political commitment is really key. Then that takes me to the last thing I would like to say, maybe centered around whether it's possible to have 20 by 35, by 2035. I think it's possible. We should dream big. But what it takes is to have a strong political commitment and walking our talk and redeeming our pledges. I'm really encouraged that many countries are already signing, but doesn't end in the signing. We have to really walk the talk. And the global solidarity is really important, but doing what we should do locally, make it happen. It's the actions, the fighting, the day-to-day engagements that make things happen. Meaning, it's up to the countries, up to us, to really commit to walking the talk or not. So that's the most crucial one. Global support can only complement. That's what we believe with our colleagues. It's the local action that can transform or change the tide. That political commitment, that community's ownership, community mobilization, like the Semaul Undong of South Korea. Of course, when I say this, it's like stressing on what we're going to do today, because we will discuss technical issues, and that's where the wheel touches the ground. And that's very crucial for many countries to really take on. And today is also very important, because that helps us to really engage in real action. So let's try to use the second day for this opportunity to prepare ourselves for real engagement, to get into action, to get into combat, to really think about how we can become good fighters. And finally, I believe that if there is a way, the will, there is a way. And we have to stick to our goals, and we have to keep our solidarity, and we have to be accountable to each other. Thank you so much indeed, and thank you so much for this opportunity.